It is my pleasure to welcome you to Women in Surgery. This is a series that highlights our excellent surgeons at Houston Methodist. All of them just happen to be women. Today, I'm very excited to welcome Dr. Mobley. She's a critical care and a liver transplant surgeon. Welcome, Dr. Mobley.
Thank you for inviting me, Dr. Schaal. I'm so happy to be here.
So how did you become to be a liver transplant surgeon?
Yeah, that's quite a serendipitous path. Everything has worked out to be exactly what I wanted, and none of it was planned. So I often say the universe has a plan for you. You just kind of have to roll with it and ride the wave. So I didn't even plan on being a surgeon initially. I wanted to be a scientist. I was in graduate school and got my PhD in molecular physiology. It was during that time I became more interested in medicine. There were a lot of physicians in my department, and I decided to pursue medical school and get my MD PhD.
Wow.
Yeah. So at that time, it's famously known amongst my friends that I said when I started medical school training that I was never going to be a surgeon. So I was not planning on being a surgeon.
Why did you say you're never going to be a surgeon?
You know, I had this idea in my mind that surgeons were stiff and kind of unfeeling and not very caring. And I really wanted to connect with patients and be change their lives and really be a part of their healing process. And I didn't feel like surgeons gave off that kind of persona. And so that's why I wasn't initially drawn to it.
So was there a person that influenced you to go to surgery?
Oh, yeah, Dr. Tarpley. Dr. Tarpley was the program director at Vanderbilt University, where I did my medical school and my PhD. He is an amazing person. His career is just like unbelievable. He spent many decades doing mission work and actually lived in Africa for a long period of time. He still goes back there to do mission work. He calls it his second home. He was very instrumental in my interest in surgery.
So he brought you into a field that you didn't want to go to. So what were your concerns initially when you just started your path there as a young resident?
So it was, I had already been in school quite some time, and famously amongst my family, they told me that I was just going to be a professional student, and my plan was never to actually get a job. So, so my dad was like very happy when I finally became employed. But the path to becoming a surgeon is very long, and so it was some concern about the length of training. And
how long is the training?
Well, if you become a surgeon, a general surgeon, you do your 4 years of undergraduate school, 4 years of medical school, and 5 years of general surgery residency. I actually took the not planned long path of including another 5 years of time getting my PhD, another 2 years of doing research during residency, and then 3 additional years in fellowship training.
Wow.
Yeah.
So liver transplant surgery is additional 3 years on top of surgical residency.
The liver transplant surgery fellowship is 2 years additional, and then I did another additional year of training in critical care.
Wow. Okay, so you are not an overachiever.
Not a bit.
So indeed, these days that you come to a specialty that is majority male, what do you experience? Tell us.
It's had its ups and downs, I would say. I think initially as a medical student, one of the things that I remember being interested, initially thinking pediatric surgery, I was doing the pediatric surgery rotation as a medical student, along with one of my male medical student colleagues who was going to be a pediatrician. And so we were, spent the whole rotation together. I spent a lot of time kind of being the overachiever that I am. And at the end of the rotation, the pediatric surgeon asked the male medical student whether or not he wanted to, actually do a key part of the procedure that they were doing. And he actually said no. And he's like, well, don't you want to be a surgeon? And he was like, no, she's the surgeon.
Wow.
And so it was one of those times where you recognize that kind of despite how hard you're working and, the residents had given me really good reviews and everything, but still being female and him being male, the the stereotype of I was the pediatrician, he was the surgeon still prevails.
Interesting. And so how many of your classmates were female in residency?
Oh, in resident, well, one of the reasons I went to University of Michigan for my general surgery residency, one of the reasons why I went there was because it was one of the few places that had a lot of female surgeons. Dr. Lisa Coletti was our program director, Dr. Simeone, Dr. Deal. I mean, the list went on. Of all the places that I went to some great residencies to interview. It had the most women there, and I wanted to be at a strong residency, but also one that had a lot of female leadership.
So that's interesting that the fact that there were other women surgeons in that program played a role. Do you feel that you are now the role model where people, young residents, when they come to interview, they look at you as a role model?
They do. It's so weird because I don't feel like a role model. I still feel like that medical student who's just trying to, do the right thing for the patient, learn everything they can. I think one of the great things about surgery in general is you're constantly learning. And I always feel like there's more to know. And so when I talk to the female residents and all the residents who are interviewing, I tell them it's a great career because you're always learning. And for the women, the female residents who come in and interview, they definitely, have heard, that it's women here. And I'm very happy to be a part of a institution that has a very diverse representation. So it allows people to feel comfortable coming here.
When I talked to Dr. Gaber, your chair, he is very proud that 40% of his faculty are women. Is that unusual in the landscape nationally?
Oh, exceedingly unusual. The most departments of surgery are still predominantly male, and it's very unusual to have that many women in surgery. In fact, even though in medical school there are 50% female applicants or female medical students, still in surgery, there remains like a huge disparity.
And why do you think that is?
So, it's interesting. Today, we actually had we have fellowship interviews for liver transplant today. And I was talking to one of the female applicants who initially was going into internal medicine, but had always wanted to do surgery. She ended up switching and coming to surgery. But the same thing that you often hear is that it wasn't going to be friendly towards women in surgery, that your lifestyle was going to be impacted, that, family planning issues, lifestyle issues are always a concern.
So would you say that these concerns are
real?
Are real?
Yes.
Yes. So tell us from your experience, what did you, I want us to, there are many listeners and viewers out there that are wondering how tough it really is. And I'm sitting here, it looks like it's really tough, but tell us, first of all, tell us about let's say a day in your life.
Oh, wow. So a day in my life depends on the day. Usually when I'm in the ICU, it's pretty structured. It can be very busy. We start rounds. We do multidisciplinary teaching rounds. So it's a great interaction with the residents, the APPs, where you do a lot of teaching. And then as usual in the ICU, there's always chaos. There's someone who's unstable. And so there's lots of bedside teaching, which I really like. So you get to see in real time pathophysiology and actually intervene by giving different medications. And so instead of reading in a book how medications work, you see in real time how you can give a medication, change someone's hemodynamics, and the teaching along with that is great. The operating room, though, where, kind of where my heart lies, is kind of my happy place, I call it. It's the place where we get to really change people's lives. And the days can start very early. We usually start cases sometimes between 5 and 7 a.m. The cases are pretty long. They take about 6 hours or so. And then we spend the rest of the day taking care of the patients, waiting for new offers to come in. I say, when we're on for liver transplant, I always say the only thing predictable about your schedule is that it's unpredictable. So you kind of wait around and see if there's going to be a transplant happening. And it's always feast or famine. The week I was on, I think I did one transplant the entire work week. And then over the weekend, we did 5 transplants.
Wow.
So it's like, you kind of rest when you can because it's going to get busy.
So in these days that you're on call for transplant, are you happy when you have many transplants, or are you saying, oh my God, another transplant?
So actually really excited. So one of the good things about being both a critical care doctor and taking care of these patients before they get transplanted, we are really rooting for them to get better. So every time you hear about a patient who has gotten an offer for a transplant, we're very excited because often they've been in the ICU for many days, sometimes weeks, and the entire ICU, I have nurses coming up to me, the respiratory therapist, saying, yay, it's finally their time. We've been rooting for them. The nurses have been praying with the families. And so everyone is super excited. So every time we have a chance to give a patient the opportunity, it's amazing.
So what have you seen in your career? We talked about long studies, many years in your career, and then how many years since you graduated? Also many years.
I finished officially in 2013.
Okay.
Yes.
So also a decade of really a surgeon in action. In all these years, what have you seen in medicine that really excited you, that you said, oh my God, I never dreamed that this could be, specifically in liver transplant? How did this field change?
So one of the great things about transplant is that it's a field that's still relatively new. There's so much that's left to be learned. We don't know enough about the immune system. We don't know enough about the failure of organs. And so there's always something to be learned. One of the great things that's happening now is the way that people donate organs and how we preserve them, and then how we preserve them before they're transplanted. Right now, we call it the rise of the machines. So we have different methodologies to get organs from the donor to the patient. Believe it or not, that it was pretty archaic. We actually would get a cooler, like the same cooler that you would see like in Target. You put ice in it, and then you would put the organ in it and travel to the recipient. And that's the way it's been done since the 60s. And so, with no changes. And we always knew that this was bad. The organs get injury to it. If it's on ice too long, they don't function well. But we never really had a good way to improve that. And now we have these machines that will either pump the organs until they're transplanted, or we have ways to preserve perfusion to the organs until they're transplanted. And overall, they have done miraculously better than putting them on ice.
Wow, fantastic. So really people live longer now after transplant. You've seen it in your lifetime.
So right now, it's so new that the data is really only about 2 years old. Actually, Houston Methodist was one of the first hospitals that participated in one of these studies of these machines. And that data really just finished about 2 years ago. And these machines were FDA approved about 2 years ago.
Wow, fantastic. So data is still to come, but
yes.
Some things, I'm a scientist too, and some things are so obvious that you don't really need to wait 2 years.
You don't.
Because you already know that that's a superior way to do that. And that's fantastic. I wanted to ask you about surgical techniques, specifically in liver transplant. Have you seen an evolution in the technique that a transplantation is done?
So the technique that is done, not necessarily. We still sew the organs in the same way, but the management of the patient has gotten so much better that it's become like a routine operation. So I remember in residency, the first transplant that was done at University of Michigan, where I was, had a photo, and it was like 50 people in the room, and they were all very happy that they had done their first successful transplant. And now, like, the idea of needing 50 people to get one operation done seems like crazy.
How many people are there?
It's really just the surgeon, an assistant surgeon, the circulating nurse, the nurse that scrubs and hands you your instruments, and the anesthesiologist.
Very few people.
Very few people, a lot less than 50.
That's fantastic. So how it is to be really the commander of that ship, right? You are the surgeon. Everybody else needs to listen to you. How do you feel in that position?
Yeah, well, it is scary. I mean, you're a surgeon.
Yes.
So, when you first finish, it's one of those things, when you're a chief resident, you're like, oh, I know I can do this, like everything. But then what that first day when you walk into the room and you kind of look to your right and look to your left and realize like, your attending is no longer there and it's really you, it's a bit scary. But but exciting and really allows you to realize the culmination of all those years of study and training that you've been through, and allows you to focus on the patient and make sure you take care of them. The patient's always at the center of what you do, and a lot of lessons that you learn in surgery that, how to stay calm, how to build teams, how to, keep everything, again, focused on the patient so that you can take the best care of them.
Wonderful. And so I guess when you were growing up to become what you are today, I mean, from being a little girl, right? I know that you wanted to be a scientist.
Yes.
Did you also excel in your hands? Did you, I don't know, sew at home?
So what's interesting, I actually wanted to be a fashion designer. So I wanted
there
to
you
learn
go.
to sew. So my mom sews a lot. And so I would be with her and sew and try to learn. And I never learned to sew very well, but I would still, it's one of the things on my bucket list to really become like a more facile seamstress. I did draw a lot. But my fascination with science was first. I'm the youngest of five, so my oldest sister, who always wanted to be a doctor, would always send me back when there were before phones to the encyclopedias, because I always had questions for her, like, why does this work like this? Why does this work like this? And she's like, go look in the encyclopedia. And so I was always like reading and thinking about things and wondering how things worked. And so I think between like science, it was always there.
Yes, fantastic. And so for people who are thinking to become surgeons, specifically women, what would be your advice?
I would say if you are interested in surgery, do it. I think that there are too many like external voices that can discourage you.
Or internal voices.
Or internal voice, yes, and unnecessarily. I think that as each decade goes by, there's more women who have continued to forge this path to make it easier for you. I think that having you in the role that you're in and making sure that we are making surgery possible for women. And I think that relies on leadership to do that. There are definitely specific challenges to women as far as, family planning and things like this. And it shouldn't be an unnecessary burden. And I think it's the leadership's role to make sure that this is something possible. I mean, women bring extraordinary talent to the surgical field, and they shouldn't be discouraged from pursuing that dream.
So this idea of an excellent surgeon, we have in our mind, if I ask 50 people, what is an excellent surgeon, or draw me a picture, not many of them would draw you. So talk a little bit about the bias that you experienced. I'm sure you have.
Yeah.
How did it affect you, and how did you handle that?
So I think that it's been there. Fortunately, I haven't been, subjected to any real like overt, biases. I know people who have. I personally have not. The things that I have found to be challenging are really being in an equitable field. One of the things that I remember from being in residency, one of my co-residents was working on a study that we had talked about and I was interested in. And then he told me, it's like, oh yeah, well, I'm writing the paper with, the attending. And I was like, well, how did that happen? And he said, well, we were in the locker room and we were, just kind of talking. And, I brought up what we had discussed, and he said that we should start working on it. And I thought, well, I'm never going to be be in the locker room with, with the attendings. And so it's things like that that really can, prevent you from moving your career forward. And so, again, I think it is people who are in leadership roles who have a responsibility to make sure that they are giving everyone equal access to, to opportunities.
There must have been hard moments being maybe the only Black woman in liver transplant fellowship, and maybe only 14 women all over the country. There, it must be hard.
Yes.
You make it seem so easy, but can you share a little bit of the hardship so people who are watching can say, okay, well, it is difficult.
Yes, it is difficult. I can be isolating. It can be, it can definitely reinforce your imposter syndrome and give you this feeling that you don't belong. Especially,
You have that?
Yes. Yes. I think, yeah, for sure. And, I think, as women, we tend to, and especially minority women, we tend to work harder and strive for this perfection and this kind of ideal, that you have to be better, you have to work twice as hard. And I think I've played into that, and it's been very difficult to not get burned out, which I think I'm trying to get better balance in my life because of that. One of the things that I want to do now that I have more of a voice is to have a structure that doesn't require women to have to do much more and much more effort than anyone else. I always say it's kind of like the Fred Astaire, Ginger Rogers thing, where you shouldn't have to do everything that a man does plus backwards and in heels. You shouldn't have to work harder. And so I think it's difficult when you are not in a position where you have a voice to actually speak to what those challenges are. But now that you have a voice, I think it's incumbent upon me to be in those rooms to actually speak for the people who don't have a voice. So I am actually the vice chair of DEI within the Department of Surgery. I work with some high school kids to give them opportunities. I am active on our CCC committee for the residents to make sure, there's representation and there's a voice there for everyone. And so it's important to be in those rooms.
So you talked a little bit about the importance of other women in the field who support you. What kind of support groups you have and used?
Oh, so I think, well, one is my family, of course. I have 4 older sisters and they're amazing.
So you're 5 girls?
5 girls.
I have 4.
Oh,
and that's it.
Yes. Yeah. So amazing. So I feel I have like 4 built-in best friends. So, but within medicine, I have, the friends from residency who are surgeons. Within transplant, there's actually a very small group of African-American women who have ever been trained as transplant
How many?
surgeons. 14.
14. That's
14.
nationwide.
Nationwide since the beginning.
14 African-American women. That's a very small group.
Yeah.
Okay, so
I
you
was
know
number
all of
5.
them?
Yeah, so we know all of them. So we're actually on a chat group, and so we talk to each other frequently. We bounce ideas off each other about research. We bounce questions off about patients. We talk about challenges that we're having in our workplace, and so it's really a great support group.
Tell me a little bit about women mentors. You mentioned a little bit, but tell me right now in your role, do you have a woman mentor?
So, interestingly enough,
I can be your mentor.
Yes, I know. I actually, right now, I actually have to say I don't have within Houston Methodist, I don't have a woman who is my mentor, but I am recruiting. So if you would like the role, I would be more than honored
I would be
to have
honored
you. Yes.
to be your mentor.
honestly, right now, I have great mentors in both Dr. Gaber and Dr. Gopro. I think I've actually learned a lot about mentorship from them. They have been instrumental in not just helping to build my career, but promoting me, putting me in positions where I didn't think I was ready. And they're like, no, you're ready, giving me opportunities to speak, regionally, nationally, even internationally. And so really promoting my career. They've been, I mean, I wouldn't be here without either of them.
And I know you are serving on the board of Houston Methodist Hospital. So tell us a little bit about what you do there in the board and why is it important that you are there?
So it was surprising to me actually when Greg Nelson, who's the chair of the board, approached me. I was flattered and surprised that I was even being considered. Being on the board has really been eye opening. I I think Methodist is a fantastic institution. I think being on the board has only solidified that. I have found the board to be very committed to excellence and making sure that we live up to the standard that we of Houston Methodist portrays. Being on the board as a physician, I think the people who are non-physicians rely on us to make sure that clinically we're maintaining our eye care values and clinical excellence. And so they rely on us for that. And I think they have been very, they listen to our voices. They hear, we're kind of the boots on the ground for them, and they're really responsive to physician needs.
Yes, I think it's important also that you're not shy. And I've seen you speak in board meetings, and I think it's really, really important because sometimes, the first time I went to a board meeting, it's a little bit scary.
Yes, very scary. Yes, a lot of important people in that room. But, all of them have approached me and introduced themselves, made me feel welcome, and really want to hear what it's like to be a physician at Houston Methodist so that we can continue to live up to those ideals and make things better. And it's been a fantastic experience.
Wonderful. Have you felt that you personally have made any sacrifice to become you?
So I mean, it's been a long road. It was a lot of training. For me, I know people will think that's a sacrifice, but I kind of enjoy school. I mean, if you remember, I told you my dad thought I was going to be a professional student.
I'm a professional student too. I love studying.
Yeah. So it is a long road, but and a lot of delayed kind of gratification until you kind of become an adult with a job. But other than that, I think it's been far more rewarding than the sacrifices that have been made. I think it's a unbelievably a rewarding career to be able to take people who are in desperate need that without your help would not survive and be able to offer them a chance at life again and really not just transform that patient, but really transform a whole family because it gives them their loved one back in many more years of, holidays and, trips and, all the things that they, do together as a family.
Nationally, are we meeting the need of liver transplantation?
No. So there is a shortage in organs, and people die annually waiting for liver transplants. Nationally, in 2023, there are over 46,000 transplants that were performed, and that's all organs, but there's over 100,000 people who are waiting. For livers in particular, there were over 9,000 transplants that have been done, but over 15 to 18,000 patients who are waiting and listed. So thousands of people die waiting for a liver transplant a year.
Wow. So we can still do better. And how might we do better? What's there in science that is really allowing us to do better? Or what's the hope? Or how are we going to meet that challenge?
So there's so many things on the horizon. So one thing that's happening now that I said with the rise of the machines is that as we have donor organs that are not of the best quality, that by putting them on ice and essentially like kind of freezing the organ and then trying to, warm it back up in another human is not the best way to perform a transplant. And so with the new machine perfusion, we're able to take organs and keep them in a better condition so that we have more organs that are available to be transplanted. That's actually been fantastic in liver transplant. And even here at Houston Methodist, our numbers have been increasing annually. And a lot of that has been due to these machines.
So this ability to preserve organs better. How about growing organs in a lab?
Yeah. So all of that is very exciting. So I don't think any of that is on the immediate horizon, but that is like research that is ongoing and is going to be impactful for sure, hopefully within our lifetime. There are organs from pigs that are being used and transplanted. The barrier to that has often been immunologic barriers, but we've been able to overcome a lot of that with science, as we had talked about before, about using CRISPR to get genetic modification so that we can overcome those immunologic obstacles between animal and human. We were talking about 3D printing of organs. I'm actually working on a study where we're actually taking liver cells and injecting them into lymph nodes so that the lymph nodes will then start to function like little mini livers that can reverse some of the effects of liver failure. So there are so many things on the horizon.
So you're still a scientist? You're not only a surgeon?
I want to do more science if I could, but, patient care comes first, but I still love science. And, as all surgeons, science is an important part of that. I think we are at the forefront of seeing what the pathophysiology can do to a patient. And ultimately, when we can't fix it, and we're all fixers by nature, surgeons. And so we go back to the lab and try to figure out how we can fix this. And so science is a huge part of that.
Yes, I'm a clinician scientist as well, and I kind of share, a lot of what you said. It really speaks to me. But one thing that I really appreciate is the opportunity to take things from practice back to the lab. You don't have to do it yourself, but you can take the ideas or lead a team and then develop it back to maybe a treatment for patients. And this is really what a clinician scientist can do. And there are very few clinician scientists, in the United States and in the world. But this is why it's so important to really invest in clinician scientists as yourself and others. Are there other clinician scientists in your department?
Oh, yes, there are. I think the main clinician scientist in our department is Dr. Gaber. He's full of ideas. If you bump into him in the hallway, he always has another study for you to take on. He's like, oh, hey, I have this idea. And so you're like, oh, another idea. It's like another research project to take on. So I think he sets the tone for the department and really promotes the surgeon scientist as the standard in our department.
Dr. Mobley, what brings you joy?
So in my work life, what brings me joy is seeing the patients do well. Again, I spend a lot of time in the ICU seeing these patients while they're really, really sick. I get to know the families, and when I see them do well, it's great. One of the kind of highlights is a patient who I took care of who actually went into acute liver failure after pregnancy. And so she didn't even remember anything that happened when she woke up with a new liver.
Wow.
She was like wondering why she wasn't pregnant anymore. And so every year, it's been many years now, they send me a picture of their daughter.
Wow.
And on the date that she was transplanted. And it's like, you couldn't ask for anything better than that.
Wonderful. Dr. Mobley, you're transforming lives. Thank you so much for what you do. I hope you inspired many today.
Thank you so much for having me. I mean, this series is fantastic. You are an amazing leader. We're so glad to have you here at Houston Methodist. You are an inspiration to me.
Thank you, and thank you for watching.